Yashodhara.
Yeah. Good afternoon, everyone, and welcome to the first episode of our talk show series, Guide to Good Gut Health, brought to you by IHW Council and powered by JB Chemicals and Pharmaceuticals. Today, we are going to talk about a topic important to many of us, especially parents. We're exploring the world of probiotics and their impact on children's health. Our episode, Are Probiotics Good for Your Kid?, promises to share a lot of information with all of us today, especially with the parents. I am Dr. Yashodhara Sharma, your host, and we are today joined by Dr. Ravi Shankar, a pediatric consultant from Kaveri Hospital and MK Hospital in Chennai. Dr. Shankar is here to share his expertise on this very important topic today with all of us, especially with the parents. So, if you are a parent interested in health or just curious about gut health, this show is definitely for you. Dr. Shankar, before we delve into the world of probiotics, I would like to ask certain basic questions which resonate with our audience, especially with the parents who have joined this show today with us.
Yes, ma'am.
How does an unhealthy gut directly affect a child's health, and what are the some of the common issues that arise from it, and how does it alters the behavior of a child?
Right. So when you look at it, the unhealthy gut basically means the gut has been colonized by different microorganisms than what are beneficial. So beneficial microorganisms are called probiotics. So it is technically called a concept of dysbiosis, which means your gut is just out of sync. So basically these abnormal pathogens, basically, they send abnormal signals to the skin, to your brain, to your respiratory system, to your kidneys, to your liver. And when these abnormal signals are being sent, so there is more of a chance of non-communicable diseases like heart disease, obesity, then worsening of behavior and as an autism and things like that. So this is how the gut directly benefits or directly affects the different aspects of the human body.
That's indeed a very relevant and significant information, Dr. Shankar. Dr. Shankar, our audience would definitely like to understand more about probiotics.
Right.
What exactly are probiotics and how do they benefit children?
Right. So probiotics are basically live microorganisms, which when administered in adequate amounts, basically confer to a health benefit on the host. That is the definition given by the WHO. So this was a definition given by the Food and Agricultural Organization of the WHO in the year 2001. So simply put, basically these are, just put it in lay terminology, it's basically beneficial microbes which live on the body and live inside the body and determine and give you a whole host of health benefits. So basically, when they are consumed in a daily thing, in a daily dosage or in a daily colony form, basically you have multiple benefits like they lower your cholesterol levels. They ensure that adequate amount of vitamins are being present in your body. They keep producing a lot of vitamin B complexes and other vitamins and other nutritions like nutritional elements like folic acid and things like which are being produced. At the same time, they remove unwanted toxins from your body and from your gut. And they also, very importantly, what happens is when you take an adequate amount of probiotics, they actually ensure that the xenobiotics are compounds which we can never metabolize, something like your microplastics, something like your pesticides, which are forming gaining an entry into the human body through your gut, through your diet and through the air that we inhale. So all of these things are being metabolized completely by the probiotics. So that is why a daily diet of which contains a healthy amount of probiotics is very essential for the human health. So continual human health. And also this also ensures that abnormal cells are also mitigated. So as a result of which it also prevents you from various different forms of cancer.
That's very useful information, Dr. Shankar. Thank you so much for explaining the audience about the probiotics and how they benefit the children. Dr. Shankar, in your practice, has the number of cases of poor gut health or the prevalence of poor gut health among children have increased in the recent times?
Yes. In the last decade, definitely yes. So we've been seeing a lot of autoimmune diseases, basically like inflammatory bowel disease, like your Crohn's disease, your ulcerative colitis, go up in incidence. The other things is we're starting to see a lot of food allergy. So being especially allergy to cow's milk, again, which is again an immunological problem. That is one thing that we have seen. And as a result of which, what happens is, because of many of the food allergies, you have associated components, basically like your wheezing, your dry skin, which is your atopic dermatitis or eczema as we call it. These are all the things which have actually worsened in the last decade or so. So definitively yes. So, and all of these things have a bearing since from the time that we are born. So basically what happens is, if we are being born by a normal delivery, when we exit through the mother's vaginal canal, we get coated with the beneficial microbes which are present naturally in the mother's canal and birthing tract. And when we are born by a cesarean section, so the what happens is, the skin gets coated by the skin bacteria of the mother. So as a result of which, the process, like I was detailing to you earlier, what is called as dysbiosis, starts early on in life, even before we have any control over it. And then a microbiome is established over the first 2 years of life. So the first 2 years of life really determines who you are as an individual for the next rest of your life, basically. So that is why a diet rich in probiotics, with a good foundation of exclusive breast milk feeds for the first 6 months of life, if it was with a normal delivery, that would have been the best start in life, actually.
Thank you, Dr. Shankar. This means that with this issue coming more prevalent or becoming more prevalent, it is more essential that parents should pay heed and pay attention to the gut health of the children. So, on the same lines, I would like to understand from you what type of probiotics are more suitable for different age groups, and how should parents incorporate them into their child's daily routine?
See, basically, the first thing is, you can give the best way to get probiotics is to immediately breastfeed the baby as soon as the baby is born. That way, the colostrum contains the right amount of probiotics. The skin to skin contact of the mother to the baby imparts a probiotic skin from the mother's skin to the baby's skin. That is the best start. And then when the baby suckles on the mother, or the first colostrum which comes is rich in probiotics itself. So that way around, that is the best start in life. Having said that, different age group, you have a different taxonomy, basically different species which are colonizing. So when you are in infancy and when you are at birth and infancy, it's more of bifidobacterium and lactic acid bacillus. And then slowly, as and when the thing when we mature over the period of time, there are different species which can be added into the thing. And the many of the things are actually being there in your food itself. So basically, a good diet which is very good in prebiotics. So prebiotics are the food for the probiotics. So a good diet which is rich in fiber gives you adequate amount of food for the probiotics which are naturally there in your gut. So as a result of which, good weaning food becomes paramount, especially when we are starting it at the right time, by about 6 months of age. So when we start doing this and cultivate a good amount of daily intake of something like fermented food like curds, something like homemade butter or something like that. So all of these contains a good amount of healthy probiotics, basically.
Okay, understood, Dr. Shankar. And what would you recommend? How should parents incorporate these kind of probiotic diet in the children daily routine?
So
Yeah.
basically, daily routine, the best way is to give homemade fermented food. Healthy amount of curds or buttermilk or lassi will be the best way to get it in children. The other thing is culturally accepted food, fermented food. Sometimes, the batter that we make for idli and dosa, they also contain probiotics. Some of the fermented other food, like, you have your things made out of, the sweets or any of the thing like gulkand or shrikand, or many of these things contain a little bit of probiotics. Then, of course, your dishes like your curry, what is called, that's what you call it in the north. In the South India, we call it as more Kulambu in Tamil. So that is what it is. So these all are containing a lot of probiotics again. So when we incorporate it on a regular basis, definitively that's the best way of getting it in. Having said that, there are newer formulations and preparations of wellness products, which are nutraceutical products, which are scientifically advised, and enough studies have been done. So if the child is not taking any of this fermented food daily, then it becomes imperative that we supplement the child's diet with a little bit of probiotics. So this is something, simple case in point is your, what is being marketed as your Yakult probiotic drink. So that is your, again, something like that, just as simple as it. And any of the probiotic yogurts and curds in the market. So all of these things contain a daily amount of probiotics which are beneficial for the gut health.
And are there any precautions or that parents should be aware about before incorporating probiotics into their child's diet?
Right. So most of the probiotics, basically, there should be two things. Your strain, the species, and the strain number. So all of these are very, very important that we know, understand, and begin to recognize. So it's not that all probiotics are the same. So each probiotic has got a strain, a species number, and a genus. So basically, it's like going around and shouting, in a crowded place, Ramesh or Suresh, 100 people will turn back at you. So then when you say Ramesh or Suresh from Mumbai or Delhi, 10 people will turn back at you. Then you may look at a particular area in Delhi or Mumbai, and then you shout, then, hardly about 2 or 3 people, then you name the door number and give his father's name, then one person is going to turn back at you. So something like that. So each of the probiotics has a name, a genus, and a species. So all of them don't do the same thing. So why I'm going to tell you is, so there are two, I'll give you a quote of examples. Basically, there's Lactobacillus reuteri is one of the most common probiotics that we use for, containing colic and treating colic in children in infancy. The same Lactobacillus reuteri, a different strain number, is used as a capsule form in adults, basically, to suppress the acid content of the stomach. So basically, they're the same Lactobacillus, the same reuteri, but the strain numbers are different. So that is how it is. So basically, we need to understand the strain numbers and then take it in adequate forms. And one of the most common mistakes which is being done is the way it is taken. So most of the probiotics are given before food. Probiotic should always be given after food. So that way it doesn't get, so especially the live probiotics. So they do not get deactivated by the gastric acid or the stomach pH. So all of these things matter, especially when we are taking a probiotic. And certain probiotics are in their spore forms, meaning that they have to be taken for a considerable amount of time before the probiotic goes inside the gut, germinates into the vegetative form, that is, it becomes the active form, and then starts its action. So that way around, it will take a couple of days time before it starts acting. And many of the probiotics need to build up colony counts before you start seeing their beneficial effects. So sometimes some of the probiotics also improve the behavior of the child. So these are all called psychobiotics. So if somebody has got some of the problems like ADHD or autism or something, and if your developmental pediatrician has given a prescription for any of these things, please ensure that the child has been taking this probiotics for a considerable length of time before you start seeing a benefit. Usually the benefit is seen at least when we give it for a minimum period of about 3 months. 3 to 6 months is the basic time that we start seeing probiotic, the benefits. The other thing, especially if during disease, let's say, for example, somebody has got a diarrhea and then they take a probiotic, it's usually about 72 hours within the time that we start seeing a health benefit. So whenever you're trying to prevent something, then it needs to be given for a longer period of time. Especially for diarrhea and other things, it's for a shorter duration of time. As a co-prescription of antibiotics and other things, it's for a shorter length of time. So these are the things that we need to keep in mind.
That's definitely a very significant information which you have shared with the audience today, Dr. Shankar. Thank you so much for these valuable insights and relevant knowledge which you're sharing. Are there any myths which also revolve around the use of probiotics, and what are the common misconceptions which people or parents specifically encounter, and what would you recommend? How should they address such kind of myths and misconceptions?
So basically, like I was telling you earlier, what the most common thing is basically, is this, if this a bacteria, is it going to go and infect my child, is one of the most common questions that I get. So no, it's not a question that it's going to infect your child. It is going to be fused in, it is going to share the same environment as your gut that you're there, and it's going to give a health benefit, and it is going to prevent infections in children. So many of the probiotics, actually, when you give it for a considerable period of time, especially, they are shown to definitively reduce respiratory tract infections, reduce the viral infections, so given for a considerable length of time. So adherence to the probiotic schedule is something which is very common. Having said that, ensure that the diet is rich in fiber, especially when we're taking probiotics, because the prebiotics, the dietary fiber is something which is very important, because even though we do not digest the dietary fiber is a necessary food for the probiotics to maintain an adequate colony count. That is something. And the other thing is, of course, basically, never have it with too hot or too cold a liquid or any food, basically. And anybody who's immunosuppressed, anybody who's been taking medication for cancer or steroids for any of the kidney problems and things like that, then you ask your healthcare practitioner about clarifications before you take in any probiotics. None of the probiotics have shown to cause any infections, so, but in immunosuppressed individuals, it's always prudent to take your healthcare practitioner's advice.
Understood, Dr. Shankar. So, in your practice, is there any demarcation that at this stage the child should go for, probiotics which are available over the counter as nutraceuticals, or parents should continue the natural methods or the organic methods which are prevalent in their household settings?
So again, many of the times, depending on the cost constraint, because some of the probiotic preparations are definitely a bit expensive when given in the long term. So ideally, if the child has got access to locally made, organically prepared, organically grown, locally made food that contains adequate amount of probiotics, especially for the daily requirement. But they should also ensure that the child finishes off the adequate quantity of curd. It's not just having 1 spoonful of curd or 2 spoonfuls of curd. Or that will not do. A cup of curd definitely has more probiotics than a spoonful of curd. So that is the amount that the child should be taking. So these are the things especially that we need to keep in mind. So, but when you give a therapeutic preparation, or when it's in a prescribed, in a formulation where it's 5 ml is containing so many colony counts of the bacteria or the beneficial bacteria, then definitely yes. So, if the child parent is able to afford it, then definitely yes, you can continue giving it for a longer period of time. So having said that, like I was telling you, some of the newer regulations from the FSSAI in our country, they have also incorporated probiotics in the food component. So basically, when you take the adequate amount of food, you get so many colony counts of the beneficial effects of the probiotic. Yes.
Thank you, Dr. Shankar. This really helps the parents and the audience which are associated with us today on this talk. We would also like to understand, is long-term use of probiotic advisable for children? Are there any potential risk or side effects that parents should be aware of?
Nothing that I know of that you have any side effects or risk, basically.
Okay.
Only thing is, some of the probiotics contains a little bit of polyols. Polyols are inert sugars like maltitol, lactitol, and things like that. So when you go for the long term, and especially when you're going, the dosage is higher, then sometimes you may tend to experience a little bit of laxative effects because of the concurrent administration of probiotics. But that is the only thing. Otherwise, you have better health benefits when you're given it for a longer term, especially when compared to a short term.
So there are no timelines or no durations.
No, not
No.
that many, basically. Yes.
Okay.
So many of the things you can continuously give for a longer period of time. In fact, many of the studies have shown that somebody taking probiotics for a very long period of time, especially if you look at the they call it the French paradox. Actually, the French actually have the most wine in the world, the most cheese in the world, the most probiotic rich diet in the world. So that is why they are fabulously thin in spite of the amount of cheese and the wine that they eat, and the cheese that they eat, basically.
Yeah.
So you look at it, that is the benefits of the consuming probiotics, basically, because it's helping you with your metabolism, it's helping you to keep everything at bay, and you have a reasonably long life, especially. So that's the health benefit of taking a probiotic rich diet.
That's a very relevant and significant piece of information, Dr. Shankar. Can you also help us understand, any role of probiotic in children with food allergies or intolerance? Are
Yes.
there any benefits or consideration that needs to be?
Yes.
Yeah.
Yes. Probiotics are very beneficial in alleviating allergy. So you can prevent an allergy by using a probiotic. You can actually lessen the existing allergy by using a probiotic. So basically, probiotic helps to sort of smoothen down all the aggressive chemicals which are being produced as a result of allergic reactions inside your gut. So the allergic manifestations are much lesser on your skin and on your the systemic responses, basically, because of the use of probiotics. You actually have anti-allergic probiotics which are licensed for use in our country, which you can give for a considerable length of time, and definitively studies have shown that it has worked. So some species of the lactic acid bacillus, especially Paracasea and other things, these are the thing. You have different brands in the country, and they have shown to have very good benefits. If that is not available, if somebody has got allergy, daily consumption of buttermilk or lassi in very dilute quantities, but considerable quantities, definitely helps to lessen the allergy. Yes.
That's very useful information. Thank you, Dr. Shankar. Dr. Shankar, can you also help us understand that are there any specific health conditions in children that can significantly benefit from probiotic supplementation? Like some examples our audience would like to understand.
Right.
Yeah.
So you have basically what are called as immunobiotics. So these are a class of probiotics which directly benefit the mucosal immunity. So some of these strains have shown great potential in preventing different viral infections of the respiratory tract. So these being a flu season in our country presently, the October, November, December, January until the end of February, sometimes across the different parts of the country, this is a time that we see this maximum amount of children going in for a viral wheezing, and things like respiratory tract infections, recurrent respiration infections, respiratory infections. So this is a time that when we use probiotics, especially immunobiotics, definitively there is a lot of health benefits. So there are preparations like, something like Respi Strong, which is available in the market. You can ask your healthcare practitioner. You can take it for a considerable period of time, and definitively it definitely helps. And then there are preparations called as LRGG, Lactobacillus rhamnosus GG. So comes by the name of Sporlac GG and things like that. Again, when you take it for a good length of time, really helps you, prevent a lot of respiratory infections, and also prevents viral gastroenteritis and things like that.
Thank you, Dr. Shankar. Dr. Shankar, in the context of children's gut health, how important is it to balance between probiotics and prebiotics? What role do probiotics play in enhancing the effectiveness of your probiotics?
What role prebiotics play in the effect?
Prebiotics play,
Yeah,
yeah.
yeah. So basically, ideally, if they are there in the same preparation, that is the best thing. So when you have prebiotics in the same preparation as a probiotic containing thing in the same preparation, it is called a symbiotic. So basically, that helps you. Like was explained earlier, a prebiotic is basically the food for the probiotic. So basically, when you take an adequate amount of prebiotics, it is going to modulate your gut environment to be conducive for the growth of probiotics and adequate colony count, which will definitively help you. And adequate amount of prebiotics definitively, lowers your risk for developing cholesterol, bad cholesterol, lowers your risk of cardiovascular illness, lowers your risk of hypertension, lowers the risk of kidney disease, and definitively gives you a more healthier skin and things like that. So because of the adequate colony count of the probiotics, which are going to be developed as a result of taking prebiotics. So a good amount of prebiotic is essential for a good colony count of the probiotics.
That's very important piece of information and clarification which you have given, Dr. Shankar. Dr. Shankar, how does the gut microbiota of a child is different from an adult, and does this also affect the type of dosage of probiotics that should be given to children versus an adult?
Absolutely. So basically, like I detailed earlier, so when you look at the infant gut, it is definitively when immature when compared to the adult gut. So for the first 2 years of life, we are still evolving. So we are developing a microbial map inside our intestine. So the first 1,000 days of life is very essential. The first 5 years of life are crucial, and then thereon we develop sort of an adult microbiome. So the adult sort of a spectrum of bacteria inside our gut. So whenever you're giving broad spectrum antibiotics, multiple courses of antibiotics and other things, the antibiotics do not distinguish between your beneficial bacteria or your harmful infectious bacteria. So they destroy everything. So as a result of which the gut becomes dysbiotic, especially when we start using multiple courses of antibiotics early on. So as a result of which, what happens is the gut gets colonized by different bacteria, which causes a lot of deleterious effects. So that is something which causes a lot of problems later on in life. So a child's gut is very paramount, and make sure that we don't take frequent courses of antibiotics before we turn to. That gives a good healthy gut. So this healthy gut defines who you are later on in life. So when you mature and become an adult, you maintain a good adult spectrum of bacteria in your gut. So again, these are all again, a lot of genetic variants are there. Again, regional variants are there depending upon the food that you eat, the environment that you stay on. And so definitively, yes, a child's gut is much different when compared to the adult gut, especially when it comes to the probiotic map.
Thank you, Dr. Ravi. This last question is for new mothers who are just learning to about the gut health of their children. What are the fundamental things they should know about probiotics,
Right.
and what guidance would you give to them? Yeah.
Right. So only thing what I would say is, please ensure that you breastfeed the baby adequately for the first 6 months of life. Do not give any pre-lacteal feeds. The initial breastfeeding is the most important, especially the colostrum which comes in for the first 2-3 days is the best thing, because that contains very adequate amount of prebiotics, because the gut gets colonized in the first few hours of life, and then over the entire lifetime it tends to get recolonized and so on. So what you feed it initially is something which is very, very important. So please ensure that colostrum is being fed to the babies. Only breast milk for the first 6 months gives you the best start in life. And what happens is, please use organically grown homemade food as that will be the best way of starting off a weaning food, especially when you're starting off at 6 months. And ensure that you keep the children off excess calories, especially coloring matter, keep the children off excess of sugar. So because this will directly impact your gut bacteria. The simple example I will tell you, it has been shown that bottle fed infants, because of the oral cavity, the bottle fed infants have more bad bacteria in their mouth, which leads to a lot of dental problems for the rest of the life. So whereas a breastfed infant has a lower incidence of developing caries or bad teeth, basically. So that is simple example. So same thing goes on with the skin also. Also prevent using very harsh soaps on your skin, because your skin is the largest organ in the body, and it has got a whole host of microbiota or the probiotics which are there on the skin. So always use, make sure that you defer using harsh detergents or soap for washing and things like that. So because that will make the skin dysbiotic and make the skin more prone for eczema and things like that. So again, all of these things boil down to the gut, because when you start using probiotics, it gives you a good healthy skin, gives you a good amount of a healthy respiratory tract, because that will prevent infections, and definitely it also gives you a healthy signals to the brain, because this is a era of competition, so you need to have a healthy child with a good IQ and things like that. So definitely yes. So when you have a probiotic rich diet, all of these are achieved.
Dr. Shankar, that's very insightful, and I'm sure all the mothers and all the parents who are watching this show are totally understanding the importance of gut health. One key takeaway or essential advice to all the parents and the mothers who are listening this show about probiotics and gut health that you would like to give from out of your experience and practice which you have observed over the years.
Make sure your you finish off the course of antibiotics when it's prescribed. That is one thing. Please request your doctor for a co-prescription of a probiotic whenever you're administering antibiotics. So if an antibiotic becomes mandatory, then we need to use it. Definitively yes. But a co-prescription of probiotics definitely is mandatory, especially when we are giving an antibiotic. That definitely leads to good ensure that gut health is the damage to gut health is prevented, basically. So that is one thing. The other thing is, of course, please ensure that adequate amount of curds and other things are introduced early on into the child. So as a result of which, the good balance, the eubiotic balance is maintained inside your gut. So this is something, and adequate amount of fiber is intake is ensured, so the gut microbiota gets good amount of nutrition.
Thank you, Dr. Shankar. I am sure this all this information really helped the audience and the parents who are watching and listening to the show. Thank you so much for shedding light on the use of probiotics and maintaining the gut health of children. It's clear that gut is the core of a child's overall health, and the probiotics definitely play a very valuable role. And we would say that parents should always consult with a healthcare professional before giving or incorporating probiotics in their diet.
Yes.
Yeah, and if especially if the child is having any underlying health condition, like you rightly explained, everyone, the right probiotic strain and the dosages are very critical. These are the key takeaways we take from this discussion from you. And for parents, it's very essential that they follow the healthcare providers' guidance. While incorporating the probiotics or ensuring that they have a good gut health for their children. That's all for today. Do join us next time for more insightful discussion on gut health in children. Have a great day, everyone. Keep following our social media pages for more health information. Meanwhile, we'll all see you again very soon. Stay healthy, stay safe. Thank you, Dr. Shankar, so much for such an insightful discussion.
Thank you, ma'am. Thank you so much.